It's very important this time of year that when people are shopping for health insurance, and we want to make sure people remember the 3 P's when they're shopping for coverage. First, providers. You don't want to enroll in a health insurance plan that doesn't have your doctors and your preferred hospitals in that plan. So checking providers is always number 1. Number 2 is prescriptions. If you're already on medication, you want to make absolutely sure that your plan covers those drugs and get a feel for how much they're going to charge you to refill those drugs. And then number 3 is a category we call plan value. Nowadays, plans come with perks like reduced price gym memberships and that sort of thing that can be a part of your plan, and you want to shop around for those as well. We're currently in the annual enrollment period for Medicare so that people can switch plans or enroll during open enrollment. It's important to remember that started on October 15th, but it ends on December 7th. And any plan selected during that period for a Medicare senior will start on January 1st. Typically, it's people 65 years and older, and also people who have certain disabilities and are under treatment for certain end-stage diseases. When you're shopping for a Medicare Advantage plan online, it's really important to understand they're not all created equal. Networks can be large or small of doctors, benefits can change, monthly premiums can be from $0 to $100 or more. So it is important to stick to those 3 P's, providers, prescriptions, and plan value.
What about people that are currently on Medicare? Do they have to do anything differently during this enrollment period?
They only have to go online if they want to change plans. If they stay where they are, their plan will renew, and then it'll go on next year just like it was last year. But it's important that people understand there are new plans coming out all the time, new opportunities, some chances for savings. Sometimes plans enhance their value. So taking a peek between October 15th and December 7th is never a bad idea. What is a bad idea is to try to do it all by yourself. There are plenty of agents and brokers out there who are certified and bonded who will walk you through that process and show you which plans meet your needs the best.
And when is the deadline for people to make a change for Medicare or sign up for Medicare for the first time?
They would have to make sure that by December 7th, the annual enrollment period will close. Now, if you're a first-time Medicare enrollee, when you turn 65, there are 3 months before your birthday and 3 months after your birthday where you're able to sign up for Medicare.
How can people get more information if they are interested and have questions about Medicare?
Typically, you can go to www.bcbsla.com, and we can always connect you with an agent who can help you understand your choices.
Now, for people that are below 65 years old, they have an opportunity to get health care. Tell us about that.
Sure. The majority of people with private health insurance get it through their employer. And so at certain times of the year, they'll have an open enrollment. Many plans have their open enrollment in the fall. They'll be contacted by their Human Resources Department with benefits and offerings, and that'll be the time to consider their plan. If you don't get a bona fide offer of coverage from your employer, you always have the option of going to Healthcare.gov, where there are individual plans sold. There are available tax credits from the federal government. It's a great place to shop, but again, I would recommend an agent, someone who's done it before, who will do it for free and walk you through that process. Today, when you go shopping on Healthcare.gov for an individual policy, you're going to find federal assistance at a level we have never seen before. It typically is the cheapest it's ever been to buy an individual policy on Healthcare.gov, and there's more aid available. In addition to that, when you go online and apply, if you qualify for Louisiana's Medicaid program, they will refer you to Medicaid from Healthcare.gov also. There used to be in the Healthcare.gov subsidy structure a cliff where people who made as a single more than about $50,000 a year were ineligible for any assistance. That cliff is gone. When people buy benchmark health plans on Healthcare.gov now, which is very good insurance, they will find the max they have to pay out of their pocket is 8.5% of their income. The feds will pick up the rest.
Now, there's something called the family glitch fix, which is new this year. Tell us about that.
Historically, we've been living with a situation that was really unfortunate for spouses and for dependents in family coverage. When the Affordable Care Act was passed, it set very definite rules on employers and said, you have to offer to employees who work more than 130 hours a month, you have to make that offer of a certain quality, and you have to make that offer to that employee of a certain affordability or face fines. They also said you had to make an offer to that employee's dependents, an offer of health insurance coverage to them. But unfortunately, there were no standards for affordability for the spouse or the dependents. That has changed literally very recently in the last month or two. Now, an offer to a spouse or a dependent can be tested against an affordability standard on Healthcare.gov. And if that employer's offer doesn't live up to Healthcare.gov's expectations, that family can walk out of the employer plan, the spouses and dependents, and shop on Healthcare.gov and draw tax credits.
Now, what age can someone actually apply for Healthcare.gov if they do not have a job or if their employer does not offer health coverage?
Typically, Healthcare.gov will cover anyone up to Medicare age. So if they're 65 or below, or they're not Medicare eligible, they'll be able to shop on Healthcare.gov if they don't get a bona fide offer of coverage from their employer. It's hard to explain to people just how expensive it is in this day and age when you become ill. It is very easy with a small hospital stay to run up a six-figure bill. Without health insurance, without a deep-pocketed third party behind you, when you contract an illness, you are not going to get the care that you need to get well. Whether it's private insurance, Medicare, or Medicaid, everyone needs to have a deep-pocketed third-party payer in their corner when they get sick.
Do you have any caution for people that may be a little intimidated about contacting an agent thinking they're going to get a sell job?
Absolutely. You're not obligated to buy anything just because you're having a conversation with an agent. Likewise, that agent will not charge you a nickel for his services. So it's really important to understand that when you're dealing with an agent you were referred to through our website, they're going to take good care of you and not charge you.
What about people that are a little bit intimidated using a computer or get on Healthcare.gov and may have some problems? What should they do?
I can think of three really good resources for those folks. If they're shopping for Medicare, we have a series of videos called Medicare Made Easy that they'll be able to access on YouTube at our YouTube channel, youtube.com/BCBSLA. Or they can go directly to our website, bcbsla.com, and even make an appointment with an agent who will take care of them without charging them a nickel to make sure that they get through the process safely. And thirdly, tons of research on our blog. StraightTalkLA.com has years of information about the right way to shop for health insurance.
And one more time, the deadlines for both Medicare and for Healthcare.gov.
The Medicare annual enrollment period runs from October 15th until December 7th, with coverage that you select during that period beginning on January 1st of 23. For people under 65 who are shopping on Healthcare.gov, it opens on 11/1 and it closes on January 15th. But if you need your coverage to start on January 1st, you have to make your selection, push the button by December 15th. So December 15th is the cutoff for coverage to start on January 1st.
What do you say to people that tend to procrastinate and wait to the last minute?
Agents get very busy as those deadlines approach. So if you really need someone to hold your hand and make sure you make a good choice, don't wait. The later you wait, the harder it's going to be to get assistance.
And one more time, the website for information?
www.bcbsla.com.